Periods. Let's talk about it, okay? And so that's what virgin actually means. It's just gotta stick together.
What do I always say?
Listen to your pussy.
She never lies.
Sister Strain here.
Your favorite feisty feminist filmmaking duo.
You're listening to The Sister Strain. Hello and welcome back to the Care to Share mini-series. Today we are talking with an expert about harm reduction. I think there's a lot of confusion about what it is, how it's mandated, why it's essential. So we have a lovely guest here who's going to introduce herself and tell us a little bit more.
Hi everyone, really grateful to be here. My name is Jordynne Lindsay and I'm so lucky to be the Community Drug Strategy Coordinator with the Chatham-Kent Ontario Health team. And through that role, I get to work a lot with Reach Out Chatham-Kent, or R.O.C.K.
Wonderful. Thank you for coming in today and joining us to have this very important dialogue. I think the first thing that we should just put on the table, what is harm reduction?
So harm reduction has lots of different definitions. There really is no one definition, but at R.O.C.K and through our community drug strategy, we see harm reduction as both an approach and philosophy, as well as some really practical tools and strategies that we can use to support people in communities that are most impacted by the toxic drug crisis and the intersecting houselessness crisis. So it's really an approach that seeks to take a different way to look at substance use from how many of us are taught or how we're conditioned and how we grow up learning about what substance use looks like and how we should address it and the challenges that come along with it. So it kind of asks us to, instead of thinking of substance use as something to be criminalized or punished, it just acknowledges that substance use has been a part of human existence for thousands and thousands of years.
It's not new.
No. Like,
I think it's also happening behind closed doors. We just don't happen to see those individuals.
Yes,
absolutely.
Where with our growing unhoused population, we're seeing it more, and therefore there's a lot more kind of judgment or stigmas going around about it because it is more visible.
Yes, yeah, for sure. And instead of trying to, go through this prohibition and stop substance use or force people to stop substance use before they're able to access help and support, harm reduction is a way of basically saying, wherever you are at in that substance use journey, there are opportunities for you to experience health and well-being and support, and you're deserving of that, no matter where you're at. And can we come together to connect you with those different types of supports in ways that support you to achieve your own goals?
Yeah.
So it works with the individual to help them, empower them to identify their goals. And then we support them to get there, however that looks. So it's very personalized. It also, on a more structural level, it seeks to undo the harms of colonization and racism and those really, really deep-rooted systems and structures of oppression, right?
Structures that I think we often as society forget about, or we forget to take into factor that kind of, like you said, meeting people where they are. And some people grew up starting at zero and progressed from there. Some people started in the negative in terms of what we expect as, all the opportunity to live a great life. I think we forget that sometimes, that not everyone grows up in that privilege of having a fresh start where they had every opportunity granted to them without, years of family and past trauma or living conditions that maybe didn't set them up in the same way as a lot of people. I think we forget that it's a very systemic thing that goes back for a very long time.
Yeah. It also points to that, like, oftentimes substance use in and of itself is not what is causing the harm, right?
Yeah.
So to your point, it's the systems and structures and the environment around it, and all those other big factors that are influencing how people are able to achieve opportunities for health and well-being. Like that is what is driving the harms and the consequences, more so than the substance use itself.
You know what I think when we look at this too, like how many people do you know, like, oh man, what a week. I can't wait to go home and have a glass of wine. I can't wait to go have a beer on the boat this weekend, right? It's like we all have our different
or a hard
ways.
afternoon and I just need a cigarette break.
Yes.
You know, it's very common.
Yeah. And so we're like, oh, that's okay. That's totally fine. But, you know, that's a human condition to kind of look when you're going through rough times, to look for escapism or something that makes you feel a little bit better for a short period of time, or something that gives you inspiration or hope. And not that that's the right way or the best way to navigate it from by any, you know, means. Of course, there's a lot of other more productive ways, but not everyone has access to those more productive means of dealing with trauma, dealing with hardship, figuring out economic circumstances.
Especially if you don't have a support system to go to for those times, right?
Absolutely.
And
I think the examples that you provided, like that is how most substance use happens in society, right? Like the vast majority of substance use, anywhere from like 70 to 90% we see in the research, happens in ways that does not cause significant harm to health or significant societal harm, right? So like what we are seeing play out in our community right now, where we are bearing witness to consequences of years and years of, you know, policy failure and divestment from health and social programs, is a very small percentage of folks that are experiencing the most harms, right? And they are like the most excluded, the most marginalized populations in our community. And I think, you know, where we get it wrong sometimes is we think that people need to experience hardship before they can get well or right, like receive care and support, and substance use is the only condition, I think, in our healthcare system where we actually require people to stop doing the very thing that they're asking for help for before they can receive treatment and support, right? Like stop doing the thing that is, you know.
Which, if it was that easy to stop it, we wouldn't be in the crisis.
Oh my gosh, right?
So we're kind of counteracting what makes sense.
Yeah. I think it's Dr. Gabor Mate, who's like a very well-known physician in this space. And he says, like, if you wanted to design a system that would keep people stuck and cause the most harm, like you would design the very system that we are in right now, right?
Absolutely.
And
I also wanted to speak to, because some of the things I've seen going around too, it's like, you didn't wake up one day and say, you know what Chatham needs? Harm reduction. I'm going to go do it. And R.O.C.K missions didn't wake up one day and be like, you know what? We really want to, we see
This
people
is what
need
we're gonna center
needles
our
and
organization
pipes. Let's go, let's make sure we provide them. Like, this is government mandated, is it not? Like, the municipality has to have these kind of best practices available to its citizens. And we're talking individuals who otherwise might find additional medical conditions on top of the addictions that they're already dealing with, which, you know, puts stress on our healthcare system. People keep talking about tax dollars and what their tax dollars are going towards. Well, that's if you want to save your tax
very
dollars.
logical people out there who are saying our tax dollars shouldn't go to supplying needles to substance users. Could you verify for us how harm reduction has been developed as a way to minimize costs and health risks?
I think to start, I'll back us up a little bit. I think it's really important to acknowledge that harm reduction came from people who use substances. Like, it was a drug user liberation movement. So that's where its origins came from. And there's this saying that we always use, like, nothing about us without us, right? And in the research space and in the work that I do, we do a lot of collective impact work. So it's a lot of like bringing different perspectives and sectors and community partners together to tackle these big
Because how do you
problems.
make policy on something if you have
Right.
never
Really
had firsthand experience with it?
Right. And what we say is that people who are most proximal to the problem are often most proximal to the solution.
Absolutely.
So that lived expertise is really what carved the way. And like I'm oversimplifying that because it was a fight. Like so much advocacy, so much hardship, so much work, decades and decades of steadfast hard work from people who use substances. Like that is the only reason that we're able to do what we do today. So I'm always so grateful for all those who came before us and carved that path. But harm reduction is now recognized globally as one of the most economic solutions to address substance use and drug policy related harms. And it's one of the most effective. So it's very, very cost effective in terms of like for a small amount of money, we can reduce significant harms to individuals, to communities, and reduce costs to our healthcare system.
It's kind of one of those things instead of treating the symptoms after the fact, let's get in front of it and be more preventative. So we're dealing with less fallout or less, economic cost on the back end.
Yeah, so it totally connects with and works with prevention. Like in the drug strategy space, we often talk about 4 pillars. So we have prevention, treatment and recovery, harm reduction, and community inclusion and safety in our drug strategy. But that's that framework used by Health Canada at the national level, that is used across drug strategies throughout Ontario, and is considered a best practice. So harm reduction is one of 4 pillars, but it's really integrated throughout. So it's embedded in prevention. We can do harm reduction approaches with youth and young adults. We can do it at end of life. So across the lifespan, there's opportunities for harm reduction. And it really, supports a lot of other pieces when we're talking about health and well-being, right? So it's not just about the substance use. There's also other health issues and social issues that harm reduction has impact on, right? So we talk about how harm reduction has significant positive impacts for reducing the transmission of sexually transmitted and bloodborne infections. Like we know that from the research. It is so well documented. We know that it also reduces crime rate, actually, right? And that's often the story that we hear, right? Is that community safety and harm reduction are kind of at odds with each other sometimes. But if you look at the research, it's actually the opposite. So what we see in the research is where we have well-supported, well-resourced harm reduction programs in communities, we see better access to safe disposal of substance use supplies. So less needles and syringes found in parks, right, which is often used as a bit of an argument against harm reduction. And we see lower crime rates in the communities and the neighborhoods where there are harm reduction programs. And there was research done by the Centre for Drug Policy Evaluation on all of the supervised consumption sites in Toronto recently that found that, in fact, crime rates in the neighborhoods without supervised consumption sites increased during the same period where supervised consumption sites were operating.
The data doesn't lie.
Yeah.
We talk about fact over opinion. That's,
But for anyone who's curious about the harm reduction that like R.O.C.K mission specifically supplies, and there's a lot of confusion there. Could you verify for us? So R.O.C.K missions is not a safe consumption site and does not do that sort of thing. So could you be a little more explicit about the harm reduction R.O.C missions?
Yeah. And because I think it specified that people were really concerned about Renee's qualifications and how R.O.C can kind of be a distributor for this. But you work with them. And we actually witnessed going out on the ground to see how R.O.C.K operates. And I noticed a lot of individuals felt very safe coming over to you and asking medical questions, showing you different wounds or various things that they were struggling with. And so I think it's important, for you to make note of how you work with R.O.C and work with those individuals on the ground.
Okay. So there's 2 questions. You might have to remind me.
Yeah, let's start with that
stuff. Okay.
What harm reduction R.O.C specifically supplies and why?
All right. So the scope of harm reduction in our community, I would say, is actually quite limited. So despite what we've been hearing about on social media and at council meetings, right, calling for less of these services by a lot of community members, what we have found in, probably 10 years worth of local community assessment and research work that we have done, where we have engaged lots of different interest holders, service providers that work in this area, as well as over 100 people with lived and living expertise have been interviewed and surveyed, and we have asked them, what do you need? And we've done this research through public health. We have received ethics reviews and approvals from research institutions, and we've worked with other research institutions to do this. We actually had an external evaluation of our programming through Lawson Health Research Institute out of Western University. So lots of different research that has demonstrated to us, or what it tells us, is that we actually need more harm reduction services in our community, not less. And so there's a whole range and scope of different harm reduction services and supports that work at that kind of practical level. So there's things like needle syringe programs, which provide safe, sterile substance use supplies to people who use substances. And that really came about through the HIV crisis in an attempt to prevent and reduce the transmission of sexually transmitted and bloodborne infections. And it also helps to increase substance use hygiene. So it prevents injury from injection drug use or inhalation drug use, which we talked a little bit about yesterday, right? And so things like abscesses or endocarditis, which is a really serious infection to the heart. So it does all of that to increase individuals' health and safety, as well as reduce burden to the healthcare system. And this stat I don't think is current, but there was a point in time early on when I started in this work, probably 8 or so years ago, where the cost to run our entire needle syringe program service was the same cost as it was to treat one hepatitis C infection.
Wow.
Right? So if we could prevent one hep C infection from someone accessing our services, we essentially paid for our program, right?
Absolutely.
I think it's a little bit different now, because hep C treatment has become much more available, and there's cost support for that and things like that. But so needle syringe program services are one thing. And included in that are safer disposal practices, so providing sharps bins or disposal bins. We also have several disposal bins throughout our community. They look kind of like mailboxes, and they're in spaces where peers told us it would be really helpful to have a disposal site.
Yeah, that's good to know.
Yeah,
helps to keep.
Which has been a conversation in the community too, about being in public spaces and not wanting to find that, or if their children are playing in the area or they're walking their dog, not being kind of subjected to that. So that is something that is actively happening on the ground, of trying to get those resources in to avoid those kind of public safety concerns.
Yes. And people who use substances, for the most part, do really care about community safety and the safety of children and parks and all that. They are driving that work. We do lots of community cleanups and things like that. They do it. Our peers that go out on outreach do it themselves as well. And then there's naloxone. So access to naloxone through the Ontario Naloxone program, another mandated program by the Ministry of Health and Long-Term Care, operated through public health units at the community level. And naloxone is a life-saving medication that's really, really safe to use, easy to use, that helps to temporarily reverse the effects of an opioid poisoning or overdose.
Okay. Yeah.
So we do have that locally as well, and R.O.C.K is a huge distributor for naloxone, which we're super grateful for.
Yeah. And I think there was some confusion about exactly what naloxone was, with some people thinking that it was a drug that was being given out to people.
When there was a specific woman who said, "Shame on you for being so proud of having such a naloxone supply."
Yeah,
and I thought, I don't think she understands what that is. So it's good to clarify.
Yeah.
Yes, breaks my heart a little bit when I hear stuff like that, but I think it is probably a note or a reflection that we have more education to do about what some of these programs do. So, and that again is because if we can reverse the effects of a poisoning in community, we can greatly reduce the cost to the healthcare system, right? And so we're building community capacity, supporting community to take care of community. People who use drugs would often rather receive support from one of their community members than from our health and service system, right?
Yeah.
And so that is about the scope of what we have for harm reduction, which is kind of just the beginning, the basics. And other communities also have these services and have had them for over a decade. The other big piece that I think we do really well in CK that has taken lots of work is peer engagement. So involving, meaningfully including people with
and I think that was another
expertise.
thing that was a confusion across town too about kind of R.O.C.K funding and where it goes to. Like the grants that were applied for and were approved are to try something different, especially we've been working in this area in different streams for a long time. I'm like, okay, so we're trying a lot of things, some's working, some not. We need to keep thinking of new ideas to try something different. And the peer-to-peer program at R.O.C.K Missions is specifically, okay, what if we tried something different? And they applied for grants, got the grant funding. And so those funds that they received are specifically to support this peer-to-peer program that you are actively a part of.
Me and Chrisette were actually lucky enough to be invited into a company, a peer group going out this week for outreach, and found out the peer programming is 7 days a week, multiple locations around town, individuals who are part of this team who are delivering food and water. When you were there, possible, brief medical attendance, delivering hygiene products and harm reduction care. That no one is seeing these groups go out every day and doing this work, hours of work. Yeah. That's a lot of time and energy and effort that gets put into, servicing these community members.
Keeping the community safe and trying a different approach to how we navigate this as a community to make sure we're being inclusive of all of our citizens, but also making it the safest as possible for everyone.
That program came about 6 years ago now, I think, kind of just at the beginning of COVID. And really what we tried to do is, in the absence of, we don't have a safe consumption site or supervised consumption site in Chatham-Kent. Unfortunately, we don't have something called safer opioid prescribing. So it's actually like prescribing folks who use from the unregulated drug supply a prescription grade alternative so that they do not have to use from the unregulated supply. And it's for folks who are experiencing many, many barriers, have tried different forms of treatment. It hasn't worked for them. So it's almost, I kind of liken it to palliative care almost, where it's like, okay, instead of trying to prevent or stop this, like this is chronic, this is progressive.
This will be the safer.
Right? Like let's just help you with the pain so that you can still live a good life. And that is offered in many communities throughout Ontario and across Canada. So we don't have that, unfortunately. And we don't have drug checking services is another part of the harm reduction spectrum, which are ways for folks to bring in a sample of the drug supply that they are using from the unregulated market, bring it in somewhere where they're able to actually run it through a test to show what kind of contaminants and what all is in the unregulated supply, and then put out surveillance information to the community to let folks know what's going on in the unregulated supply, and can then folks take steps to be a little bit more safe now that they're more informed about what is actually in the supply, right? So that might look like not using from that supply. For some, they may still have to use from that supply because that's all they have. So then maybe they're not using alone and using a buddy system. Maybe they're calling the National Overdose Response Line and having someone spot them. Maybe we always say start low, go slow, like try a test dose first, and then you can kind of increase incrementally from there. Maybe you're taking turns with folks in your community so that you can watch out for each other. Maybe you have some extra naloxone on hand for that, right? So it just helps folks be more informed, more prepared, and then it allows us to share that information with community partners to say, hey, like, let people you're working with know that this is what's going on. So we actually follow the Toronto Drug Checking Service. So we find that, it's about 2 weeks behind, but we tend to see whatever's going on in Toronto ends up trickling its way over. So we use that as kind of our benchmark.
And you do hand out test strips.
We hand out test strips
as part of the outreach program to make sure we can avoiding some of those, disaster moments that someone takes something that they did not intend to ingest because it was kind of false advertising, for lack of a better expression.
Right.
I think that gives us a much better understanding of what harm reduction is and the ways it's implemented in our community. We will be having another guest on shortly who is a mother of an individual who did require harm reduction services from R.O.C.K missions. And she's going to share a little bit about specifically how that helped her son and why it was essential. And elaborate a little bit on that with the, bloodborne diseases topic.
I did want to kind of wrap it up with something that I believe the woman at Hope Haven had mentioned, that, as long as it's about caring for these individuals in vulnerable situations in our community, that, if they're alive another day, then there's still hope. There's always hope for them. And harm reduction goes hand in hand with that if there's an individual who's already struggling with one thing, and then there's the chance to bring in another disease into the situation that could potentially threaten their life, just from a compassion piece in our community, why would we not want to keep that hope for that individual alive? Why would we not want to help put those harm reduction pieces in place that can help keep the hope alive for that individual to work through what they are struggling with and kind of come out the other side in our community.
And I think too, a message that I always try to share with folks that we're doing education with, or that we're doing training with in community, is like, we all have stigma, right? Like, we have all been conditioned by these systems and like all of the messaging that we've received, any substance use education that we got when we were kids or through the media, right, is really limited and really positions substance use to be something that should be punished and like a criminal offense, right? And I think, so we're all coming from that place, and that's okay, but we all have an opportunity and an obligation to learn and do better. And I think there's opportunities for all of us to have more conversations about.
I think like many things in our society, if we don't talk about it, it doesn't exist. But it definitely exists, and it's dangerous to not talk about it, to make sure everyone is informed in what they're getting.
We can't let our fear and uncertainty stop us from growing and evolving together. And
on that note,
did you have some resources you might want to suggest for anyone who wants to learn a little bit more and do their own research?
Sure. So we have lots of resources that we use that help guide our work. The one that really helps us with our harm reduction work is the Harm Reduction Best Practices, which were written by Dr. Carol Strike out of the University of Toronto. Yes.
You have here?
Visual representation.
We love to show
my
books.
favorite.
Yeah. I'm going to hold it closer to the camera.
Thanks.
Is there possibly an online link to
There
that
is,
resource as well?
yes.
So we can put that in the information, the online link.
As always, we will pass along any resource links that Jordynne shares with us so that you can go ahead and don't take our word for it. Go do the reading and research yourself. Share it amongst individuals. Have those conversations. We are very thankful that you came in to have this conversation with us, and we hope that this encourages more people to want to dig a little deeper, do some more research, and be sparking more conversations that come from fact and knowledge
And lead to solutions.
Yes.
Less stigma.
Yeah.
Yeah.
Grateful for you both creating the space for these conversations to happen. It's really important.
Thank you so much. So remember, CK, care to share, please pass this along so that we can get more informed as a community and get better equipped to handle this situation together.
Care to share.
You've been listening to The Sister Strain.
If you've got something you'd like to share with us, reach out to us. Contact@sisterstrain.com.
Yours in sistership, The Sister Strain.